Good afternoon, everyone. On behalf of GBS, I want to thank you and welcome you. I'm just going to make sure that I'm sharing my correct screen here. All right, perfect. So again, thank you, our attendees, for joining today. This is one of our many educational sessions for our healthcare education series. We're continuing to host these. We started them in 2020, continuing them into 2021. So be on the lookout for the availability to register for additional sessions. We're really glad that you could join us today. Always trying to bring up timely, topical discussions. Today we're talking about consumerism in healthcare, price transparency, and we'll get into that in just a moment. I'm Lindsay Bruderly, the Sales Operations Manager here at GBS. I'm doing the intro and conclusion for y'all today. As always, before we get started, I wanted to let our attendees know that you are in listen-only mode. As time permits, we'll open up the phone lines at the end of the presentation to have a little live Q&A, but please feel free to ask any questions via the chat or the questions panel available during this webinar. So as we've kind of gone through this educational series, our intent is to provide you with insight and education, drive your top initiatives, increase efficiencies with technology, and help set business objectives with the partners that we work with on day-to-day. So one of the many ways in which we are doing this, we're bringing this educational series to you, things like regulatory compliance, we've seen that. We have upcoming patient engagement. Today, we're talking specifically about financial health. We've talked about technology, flexibility, scalability, security and infrastructure, and patient and staff safety. So if you haven't been able to attend one of our previous sessions, you can head on out to the registration site. There are links to the recordings, and there are links to our upcoming sessions as well. So with that, I'm going to actually pass over the baton to Paul Horning from GBS, Vice President of Strategy and Acquisitions, and he's going to kind of give you a little intro for our speaker today.
Hey, thanks, Lindsay. Hello, everybody. This is Paul Horning from GBS RevCycle, and I'd like you to join me and Mary Hudak in welcoming Nate Spoden as our guest speaker this afternoon. Nate is the founder, co-founder, and COO of MedPilot. And MedPilot's a digitally engaged provider of services to physician groups, hospitals, and billing companies, focused on enhancing the management of patient communications, engagement, and financial responsibility. When we thought of this topic, we really thought of nobody better to really give us the state of the industry and give you some insight into planning to adopt some of these strategies. Nate's a native of Northeast Ohio. He's got an impressive track record of consulting with private equity firms, nationally recognized institutions. He's got many strengths, among them his strong technology background. He's also an expert in knowledge base and revenue cycle management, and he has practical knowledge on healthcare operations and turnaround strategies for healthcare institutions. Nate founded MedPilot with two partners, originally in New York City, and then he relocated the business here to Northeast Ohio. GBS has worked with MedPilot over the last 2 years, and we've grown to rely on Nate and his 40-person team to execute our own patient engagement and digital outreach strategies. So please join me in welcoming Nate. Nate, we are all ears and eyes.
Paul, thanks for that introduction. It's a pleasure to be here today, and like you said, it's been a couple of years now, so really happy to be continuing the partnership. Thank you all, and look forward to talking a little bit more about some consumerism and the changes that it's having on healthcare. Yeah, so maybe just to dive in a little bit to my background to start. Paul, great intro. Really, where I've spent my entire career is in revenue cycle management. The great thing is I've done this at a few different levels. Hands on the ground, operational transformations, working directly with private equity firms and buying companies out of bankruptcy, hospitals, other healthcare providers, et cetera. but really then taking that knowledge and going and being able to actually build some technology with it. So I, early on in my career, actually built out a practice management system from the ground up. So took that operational knowledge and was able to actually build something using it that, helped create some efficiencies and, better overall workflow for providers. After that, got the opportunity to go and do big box consulting at Accenture for some of the nation's top health systems. And really what you see across the spectrum is the same problems, whether it's a, mom and pop primary care group or, the #2 hospital in the nation. They all face the same revenue cycle challenges and really, challenges across the spectrum when managing relationships with patients. So seeing this sort of gap and in some respect, this opportunity, that's why I really, made the transition to help found MedPilot. And really, where we have positioned our product is as an engagement solution and more, specifically a customer relationship management platform. And, with that, it's a good segue into, why I feel consumerism is top of mind in 2021 is not only because of this gap that has existed where, patients have, slowly started to migrate to the forefront of a provider's mind, not in the sense of just care, right, which is obviously where it's always been, but now and more so thinking of them truly as a consumer. And as we shift towards the changes that are coming in 2021 and just the adoption of consumerism in healthcare, there's a few major questions that we need to ask ourselves, which are things that we'll review in detail on this webinar today. So to start, what is consumerism? I think we all probably have a general understanding of it, but as it relates to healthcare, I think there'll be some things that we talk about that maybe broaden your mind a bit. What's trending with patients right now? Where are the opportunities, if you will? And then how do we see these trends impacting, individual healthcare providers? And more importantly than that, what can we actually do about it? Go ahead and click to the next slide. Thank you. So as an initial start, really where things have come to the forefront from a consumerism perspective for patients is with regard to these new legislations. And these new rules essentially deal directly with price transparency. So what's happened is, price transparency has gone from a fad where, some people did it. It was, had, let's say, relatively, low to moderate utilization. And now it's becoming a trend. The government is essentially forcing not only charges to be pushed out there, but also payer-specific negotiated charges, i.e., what the patient is actually going to pay when they come in for services. And what this is going to do is it's ultimately going to give the patients the ability to shop around. And there's going to be many, many, many new tools that allow patients to do this. There are already several out there. If you go on Google, you can find, costs of care, and there's different things that even insurance companies are doing today to actually direct patients to, more discounted providers, because obviously it's in their best interest. But at the end of the day, what this becomes is, and will become more and more as we move through 2021, is almost a Geico moment for patients, right? 15 minutes could save you 15% or more. Well, in healthcare, why would patients not spend that quote unquote 15 minutes shopping around before they receive services? And ultimately, as patients become more and more aware of this legislation, more and more providers out there actually start to push this out and put it at the forefront of how they're almost selling their services. Patients will almost grow to expect this. And at the end of the day, information is gold. Not only does this go with price transparency, but just also in general, things like information about your practice, information about services, and more importantly, information about patients managing their health. So I think as we move in to 2021 and we start to think about how consumerism is affecting you individually, you got to think about the information that is going to be readily available at patients' fingertips, whether that's from you directly or from others in the market that may be competitors. You can go ahead and go to the next slide. Sorry, I was stuck on mute there. My apologies. So, ultimately, as we start to move forward, where do the problems exist? As you can see here, this McKinsey study is showing that affordability is one of the highest rated needs for patients. And, ultimately, with that, it's not just affordability, it's also, sort of continuity of not just care, but overall communication. As you look down sort of the spectrum of information shared here, digital is an increasing, need or desire for patients. And as you think about continuity of care, ultimately, it's going to be very important to use digital means of engagement to be able to do that. And again, not just for care delivery, but really communication across the spectrum. Ultimately, what this is sort of showing is, sort of the opportunities, if you will, but, to combat some of these problems, ultimately what providers need to do is they need to take a patient-first approach. Patients have, for example, become maybe your biggest payer. If you look at not only true self-pay patients, but really more importantly, balance after insurance, high deductible health plans, and, overall just patient financial responsibility growing. As you're looking at them as one of your largest payers, it's important to put them at the forefront. And also, as they're starting to shop around for care, these patients are going to care more about things that are going to become more and more relevant. And what that is going back to the information overload that they have at their fingertips, for example. But also, convenience is a factor. So, when patients are shopping around, they ultimately have the option to, choose providers. And some of that is going to be based off of, what they're used to, going with the, the people that make them feel comfortable. And others are going to be ultimately, based on that convenience factor. So as you're sort of, building the overall, engagement process and overall sort of approach around consumerism, you have to think about these main factors being top of mind as patients are looking, to overall, determine where they want to receive their services. So as you can see, continuing with this study, a digital-first approach is going to be key to winning. Ultimately, you can see where people prefer phone and in person, and essentially across the spectrum or consumer journey in healthcare, digital outweighs all of those. So, this is essentially, where you need to challenge yourself and say, where have I gone down the path of adopting a digital first approach? And for example, if you've started that with email, which many providers have, then one thing that we've found in the MedPilot side of things is that, email capture rates are very, very low across the healthcare landscape. Whether that's, point of service process improvement opportunity, or patients just not being willing to give that information. But what's great is on the digital approach when it comes to SMS, phone capture rates are typically very, very high. So at the end of the day, deploying a SMS engagement strategy over an email strategy is where you're going to absolutely see a lot more engagement happen. For example, everyone on this call, I'm sure, has already looked down on their phone, 2 or 3 times in the last few minutes, just reviewing, one-off text messages that may have come through. As we know, SMS it's the most invasive, really, form of communication, but, we're all looking at our phones over 100 times a day. So it's from a healthcare provider's perspective, the most effective way to keep these patients engaged. The really great thing about digital communication across all of the clients that we, deploy the strategy with is we see very, very low opt-out rates. Across the spectrum of our clients, we see less than 3% of patients opting out. And what that actually means is patients care about the information that they get from their providers. So use that to your advantage, leverage that for that information overload. Because at the end of the day, as patients are shopping around and they're looking at, what's at their fingertips and what's available, it's not just going to be based off of, price transparency. It's also going to be based off of, being, proactive in the information that you have at your fingertips that is viable or valuable to them. Things like positive reviews or, ultimately, let's say health grade ratings or, whatever ultimate, wins that you have as an organization, that's what you want to share. But from a digital perspective, patients care about the information that they receive from their providers. And it's ultimately going to be the strategy needed to not only help with patient retention, but also patient acquisition. Every healthcare provider has, a marketing budget out there and is trying to determine the best way to utilize that budget. And, the thing is with shopping around, there's a lot of patients who are really looking at large organizations versus small. So how do you continue to win over these large organizations that may have services or offerings that you don't? And what it comes down to is really the relationship management side of things. Patients, all of us as consumers, why do we wait in Starbucks, in those long lines to get our coffee? Why? Because quality wins over convenience at the end of the day. Patients will remember the experience they have and the relationship management you've done through a digital communication strategy and information overload and those positive reviews they see, and ultimately, everything that, again, they have at their fingertips to help them, stay engaged and stay retained, by your organization. So just as you're thinking about deploying your strategies and looking at the fact that digital is going to win, know that patients are making these decisions using, most likely their phones, and what information is available on their phones readily available to determine where they want to go. With that, you can actually go ahead and skip to the next slide. So one sort of driving force here in what this overall graph here shows from Deloitte 2018 Deloitte study is that even back in 2015, people were looking online about information about cost of services. And if you look, there's a major increase over time between 2015 and 2018 between not only the utilization of looking for, costs and prices of services, but also the likelihood to use it in the future. And then, with this, you can also see how that same impact has sort of grown, or you see the same correlation as you look at, the report cards for physicians. So, going back to my point of sharing your wins, patients are out there looking for ways to differentiate providers. And it's not just based off of your website anymore. It's ultimately based off of Google reviews, health grades, cost of services, as we look into, the new regulations of 2021, for example. And again, anything else that they have and are using to, help them feel comfortable with the decisions they're making. I think anywhere I go now, shopping, and I know this is the same across, many people, you're looking at those 5-star reviews and even product ratings. You're looking at 5-star product ratings when you're differentiating products. So, at the end of the day, what not only, to think about, what can be done to be proactive about this, but also what can you do internally to help better manage your external view of your business. That's maybe working with patients to get those positive reviews out there on Google and Yelp. Doing things like, checking your health grade score and promoting that on your website, or promoting, new services via engagement, whatever it might be. Ultimately, at the end of the day, sharing those wins and being proactive in your communication and engagement strategy is what's going to help you win at the end of the day. Go ahead and skip to the next slide. So to round, all of this sort of consumer-centric approach that we all need to adopt go forward, regardless of what business you're in, you can sort of see a nice trend line here that shows where people are in the stages of, addressing a consumer-centric strategy. And you can see roughly 70% of providers are already going down this path. You have some that are, in sort of no formal or nascent strategies. In reality, these are probably people who are just leveraging websites, very limited, engagement strategies, really, nominal approach around, a true consumer-centric, strategy for patient, acquisition and retention. But ultimately, a good chunk of the providers in the market have already been thinking about this. If you think about, what I did and sat with, some, a couple of the largest, health systems in the nation, these are conversations that they've been having for years. One of the things that they're all working on deploying right now or adopting are CRMs. Why? Because a CRM is what actually drives all of these consumer-centric strategies. It takes all the information at, your fingertips, consolidates into one place, and allows you to leverage that from an engagement perspective. And it also tracks, how well you're performing. So, one of the things that we deploy across all of our providers is a patient satisfaction score. And, we get that at our fingertips, but and get to share that with our clients. But at the end of the day, what's more valuable than that to the providers is that's the patients. Patients want to hear what other patients' experiences were. So, leveraging that information that you have and using it for engagement purposes or marketing purposes or Google rating purposes, all of this drives the overall approach that, needs to be taken, when designing your consumer-centric strategy. And I would just say, to sort of round this out, as you look at, all the information that, we discussed here today, and the fact that, providers are all really driving their own strategies and putting in motion things that are going to, cause providers to compete for business, I really challenge you to determine how you're going to approach this growing need, and, what is going to be, your requirement or requirements to create a successful consumer-centric strategy go forward. You can go back, go to the next slide. Great. So, ultimately, just to round all this out, we've talked about what consumerism is really, patients shopping around for care, and really the fact that competing for business is really more now than ever before at the forefront, should be at the forefront of a provider's minds, but it's definitely at the forefront of a patient's mind. And they're using tools like price transparency, quality scores, Google reviews, and understanding the overall patient experience that they've had in your office, all as factors when they're shopping around for care. Sick care is really ultimately what we're talking about, because at the end of the day, if we're doing annual wellness visits or more preventative stuff that is routine, they're more likely to stick with their primary care provider, for example, or go to someone they're familiar with. But at the end of the day, when it comes to sick care and people are shopping around, taking what's at their fingertips is going to be how they make that decision. So looking at your intake strategy, your scheduling strategy, are you using digital tools and letting patients do self-service options so that they can get in the door? And then how are you managing them, not only from a pre-appointment or pre-scheduling perspective, but also from an intake perspective. How is your waiting room? How did that patient feel when they walked in? Were they greeted? Do you have modern furniture in your office? Does it smell nice? These are all things that go into the impact of patient experience on their feeling. As they were treated, how was the care? I'm assuming exceptional across the board. But as they leave, what is that checkout process? What is this follow-up process? Do you have surveys in place? How is the patient billing experience, for example? Have you gone down the path of checking patient satisfaction on that? Do you know where your bottlenecks are and where there's opportunities for improvement? Where are your Google reviews and where do they stand and what are you doing to impact them? All stuff that is going to be at the forefront of a patient's mind, whether they're choosing a primary care doc for yearly stuff or going in for sick care when they're looking for the closest urgent care when they have to take their child. With this, what's trending with patients? All of the above, right? All of the things that are now, it's a mobile world. There's less interaction with patients with COVID. More of a need to take care of patients outside of their home. So how are you managing this? How are patients aware of services you might offer that don't exist in the office so that they don't go elsewhere, whether that's for convenience purposes or, concerns of just, COVID. Being proactive, for example, with your COVID policies and strategies and, deploying a, touchless intake process, for example, while patients are still in their car. There's a lot of tools and let's say things that have been adopted process-wise that are helping patients feel more comfortable, to go into a provider and in general to receive services. So, how are you taking that and leveraging it to develop your strategy, of managing consumerism? How these trends can impact you. Obviously this is where 2021 go forward. I mean, we're really going to be, fighting for business and fighting to retain our patients and figuring out, what is the most effective thing to keep patients happy and keep them coming back to us. But also with this, how are you engaging patients to keep them coming in for services? As patients, have the COVID scare of not wanting to leave their home and do things even related to their health. How are you being proactive in the sense of getting patients to do what they need to do? And some of that can be through engagement, but ultimately engagement isn't the end all. When I talk about deploying an SMS strategy, for example, it's less about all of the information coming via SMS and more of the notification. A lot of what we do is soft reminders, slight nudges, and we're understanding patient behavior and using that to our benefit. And really, that's sort of how these trends will impact you, in the sense that you need to leverage all the information at your fingertips and determine the best approach for managing this. And really, all of that coming up and bubbling up to the point of you really need to define, document, and execute on a consumer-centric strategy. So with all that, that sort of sums up what can you do about it. And I think it's really, first step is starting to look at your overall process for managing patient relationship management, patient experience, looking at your strategy and execution around engagement, and how well you're performing, because it's not only putting this stuff in place, but it's also managing it. I think if you look simply at marketing as a very simple example that probably everyone who's listening in has on their normal course of business, any marketing firm really should be an analytical firm. How are the things we're doing from a marketing spend equate to business or referrals or whatever it might be? And that same strategy of tracking what's working and what's not is how you're going to win, as you deploy that strategy around, managing consumerism. So, all this being said, I think there's a few questions that maybe, we want to go through here. Paul, I'm not sure if we want to open it up from here for questions, or how you want to approach the Q&A section.
Yeah, I was thinking, thanks, Nate, very, very good insight, especially on some things that I think we all thought we were familiar with, but you kind of added some additional, dimensions to it, especially on the digital. So I was going to suggest these 3 prepared questions were really just to get the dialogue going. I didn't know if we could kind of throw them out there and seek response. Kind of maybe the group can generate feedback from one another on each of the questions. So the first one we had was,
also, I'm just going to let everyone know before you go over the questions, or while you're going over the questions, I'm going to start unmuting all of the participants. So if you have any background noise going on, just to forewarn you, I'm going to unmute you on my side. So feel free to mute yourselves on your phone or whatnot if you have any background noise going on. But go ahead, Paul.
Great, thank you. So the first one, and I think Nate, he positioned it well, but January 2021 hospital requirements. How do you think it's going to impact the broader base of all providers in the next year, and even out to 5 years? Does anybody have any thoughts? Nate kind of described the fact that the price comparison and the dialogue and the support and the forums associated with that are going to be thrust upon us. And I think your message, Nate, was you probably should be a first mover and be kind of driving the message, as opposed to being victimized by the message, rather than just being silent.
Agreed. Because there's forums out there that exist to see prices. Some of them pulling information that hasn't necessarily been shared directly by a provider. So there may be information out there that you're not even aware of patients having access to the data and seeing what your charges might be, for example. So being proactive and actually getting down to the nitty-gritty of what a patient's cost is, and allowing these third-party tools that are going to become more and more relevant to have access to that data, so that they can help you win in the sense of capturing new patients or even retaining your patients as they look to shop around for services.
Any, I don't know if the unmuting's all done now, but anybody have any thoughts on the attendees on question number 1? Okay. Well, maybe just to kind of dig a little deeper in it, I guess you have two approaches. One, do you think that you are a cost-effective solution, or do you think that you are pay for quality solution, that's probably going to, you know, dictate how you design your messaging. You know, if you are more expensive than the other information that's out, you know, out for everybody to see, you're going to want to start, you know, positioning your brand and your quality and your service as high quality and you know, worth the difference or a premium standpoint. If you're cost effective or you know, you feel that you're on the lower end of the spectrum versus maybe a higher price competitor, then you want to hit on that point that you have the same quality. It's just, you know, if you're going to be paying a portion of the bill, and most are, they should think about the savings that come along with getting the same quality from your lower cost solution.
Agreed. And that's a great point, Paul. I think value-based care is really where the world's going, and a lot of providers are starting to, you know, get involved with organizations like ACOs or, you know, just places where they can win in the shared savings. And that also becomes a factor with regard to pricing, because if you're pricing on your CDM or, you know, your negotiated rates, whatever it might be, if it becomes less of a concern or not as, you know, much of a factor, as in it's not the only place where you're going to be driving revenue from, then absolutely a major strategy when it comes to, you know, pricing your charge master and services, you know, that become, you know, or will become, you know, public knowledge. Because at the end of the day, you know, as we move to this value-based care world, there's a major opportunity to, you know, not only help better manage patients' health in between visits, which is going to be lower cost, but also, you know, shift patients away from this sick care mentality and to a world where proactive care, which is, you know, where, you know, chronic care management services, you know, remote patient monitoring, all that kind of stuff comes into play. But all of that overall helps us win, and really what the ultimate goal is. You know, we talk a lot about, you know, money and finances and revenue cycle, but really, I mean, what the goal of providers is to help the health of their patients, and not only do that one time when they come in for, you know, a flu vaccine, but also continuously, you know, manage their chronic conditions, et cetera. So, you know, just something absolutely to take into mind that, you know, as you're looking at expanding, you know, your offering and services, you know, looking at those remote services to help, you know, what's trending with patients and, you know, what you can do about it. That's definitely one caveat, and that could help overall, you know, help make it more of an open door for patients to, you know, come in as they look at your overall charge structure.
All right. Any other thoughts on question number one? Okay. Let's move on to question number two. Is you know, we're still relatively early in this process. I think the infrastructure of the engagement, communication, and the feedback are still being built out. But is there anybody who knows or can identify what strategies have absolutely seemed to be working, or which ones have failed so far? I would put on the list. I think Nate, you know, made the point. If you've got a website or a portal, you know, associated, you know, website, and it's kind of the bare minimum, that's probably not good enough. It's shown results that I think you need them to basically add to the universe of information that's provided to people when they are doing their searching or their qualification, but it's probably not enough. So I think that one's shown results, but it's teetering on failure if it's the only thing you do. Any other examples? Nate, can you bring anything to mind of maybe what hasn't worked, where people, you know, maybe had the perception it would be a big win, but it didn't pay off?
Yeah, I think patient portals in general, right? Patient portals were supposed to be the end all be all. And in reality, there's just really low adoption across patients. Sure, patients will go in there and check lab results or, you know, some information of, you know, whatever it might be with regard to their health, but they're not logging into the patient portal continuously to, you know, have their relationship managed, right? They're doing that one-off. And so I think, you know, providers saw the portal as a means of communicating with their patients, which can and does work in some cases, but it's really just one avenue and really focused on the clinical side of things. That's a small piece of the overall equation when you're looking at consumerism. Patients can get their clinical information and really be cared for clinically, anywhere across the board. What they can't get and won't be consistent is how the relationship's managed, how they feel, how proactive you're being, all of that good stuff. Like, when it comes to the, touchy-feeliness of things, that's when, patients get that, warm and fuzzy feeling of, hey, not only do I like my provider because they, give me this good quality care, but because, hey, they really care about me. Why do they care about me? Because they're proactive in managing my health, for reaching out to me about things, for making me feel good, for adopting technology, for being proactive in their communication, and not just, having me work with them as I get sick. But that being said, the strategy I think that sort of failed there is, or I've seen fail is, providers say, we don't need another portal. We don't need another means of engaging patient portal. And I would challenge you to say, what is the utilization rate of your portal? What is the adoption rate of even people logging in for the first time ever? And then how have you seen that work in the sense of communicating with patients outside of clinical needs? And I'd say, most, if not all, will see that there's a real gap there, right? And that's where most providers across the spectrum will need to start to look at more of a CRM or a customer relationship management platform that can help them, do things like surveys and, help with Google reviews and overall keep the patient engaged around marketing efforts and tile that back to the clinical side as well. So notifications about, updated clinical information, or maybe you are directing them to that portal, but your notification process has been defined in your CRM versus a EMR, which an EMR is not a CRM. An EMR is a place to house electronic medical records. And, from there, it's the only real piece of information that patients feel like they're deriving from it. So don't let your EMR and your PM be your end all be all. There's definitely cost-effective solutions to deploy or to help you deploy a really consumer-centric strategy.
Good. Okay. Any other final thoughts on what's worked or what's failed? Okay. All right. I guess the last kind of prepared question we had was, so somebody, Nate, you're very convincing, and we see that adoption chart, and we don't want to be on the left-hand side. We want to be on the right-hand side. So how can a practice or physician get started with addressing the consumerism requirement? If you had a playbook and I felt like I was at the website portal level, what's my first next step to start down this path?
Yeah, that's a great question. And I think ultimately it's going to be, defining someone in your organization who's going to be leading the efforts as a first step, right? And then from there, it's going to take some market research or, partners like a GBS, for example, are really going to really help define and execute, on the different opportunities for deploying the strategy. But as you start to, pinpoint someone who's really taking lead and being the person that's going to execute, it's starting to look at your entire spectrum of areas that you can and should be communicating with patients and starting to really build your playbook for each one of those avenues. And to list I would say most, but not all, it starts with pre-appointment, right? I mean, it's, if we go through sort of the life cycle, maybe it's engaging patients pre-service, and that could be for an appointment reminder or pre-registration, the follow-ups prior to actually coming in, the intake process, right? What does your digital intake process look like? And even like we talked about, touchless intake, where patients are still in their cars and sort of that COVID related intake process, if you will. And then as you go through the life cycle of, the patient, after they're treated clinically, and maybe even before then, what is that office experience like, both in the intake and then also in the office when they're actually communicating with the physician, and then on the outtake as well. From there, what is your engagement process following a visit? If there's lab results coming, what are you doing to keep patients aware or notified of those lab results, right? Or up and coming appointments, or routine things that they should be doing for their health, and or surveys related to your visit. So you go through that cycle, and then you get to, patient billing. What does your patient billing process look like? How involved are the patients? What's their experience been? And you start to define, not only technologies, but processes that, you can deploy across these different areas of, the revenue cycle slash, the patient journey, that will help you really start to, address consumerism, because it's gonna live in every area of your business, in the sense of an area where the patient's interacting, and it's gonna, it's ultimately gonna end with, the overall execution of how you've given that patient the experience that they're going to remember. And then as other patients, and that's more of patient retention, if you will, on the acquisition side of things, it's how are you being proactive to go out and, put yourself out there, put your wins, your Google reviews, your patient satisfaction scores, your technology or your health grade score, whatever it might be, how you're leveraging that to actually go and acquire new patients. So I think it's sort of, phased in those two categories. But as you look at defining this and really putting someone who's going to be the forefront of leading this, it's both a process, a play in all of these different areas, but then also, technology solutions across the spectrum that can help. And really, I think it starts with defining even the most basic, CRM. CRMs are not very expensive to deploy. I think that's, a little bit of confusion in the market of, what a CRM can do and how much it would cost. But looking to align, technology solutions and process solutions across each one of these spectrums will help you really ensure that you have a plan of addressing, interactions and overall, patient experience across the spectrum. And that all ties up to, or bubbles up to, the patient-facing, sort of view of things, which is going to be, the positive view that they look at when they look at you and your website and Google and everything else. And then also, the experience that they remember and or will have, when they actually, work with your practice.
That was a good answer, Nate. I was just going to say start collecting cell phone numbers.
Yes, that's the move. That is the move. Cell phone numbers, and then being able to engage based off of that.
Opt-in and cell phone numbers. Critically.
Yep. Yeah, it's funny because you think of, it's such a simple thing, but, so text messages have been around for years and years and years, but there's a blue ocean out there. There's, you might think that, a lot of providers are doing this today, but to be honest, it's something that's still coming into play. And, I think there are some compliance concerns to your point of, getting consent, Paul, but in general, there's nothing limiting anyone from using digital engagement and really doing what we've talked about here and creating a digital first approach. So just leave, hopefully that peels back the onion a bit of giving you the opportunity to go and start to build the strategy, but it absolutely needs to take a digital first approach, encompass technology and process across the spectrum, and then, use the resources at your fingertips. Obviously, partners like GBS and MedPilot are great resources for this kind of thing, but, there's tons of technology solutions and vendors out there who may not solve all the problems, but definitely, help facilitate, bridging the gap for different aspects of, this consumer driven strategy.
Great. All right. Thank you, Nate. Lindsay, do we have any questions from the group?
I have not seen anything come across in the chat or the questions.
Okay. I know we have a few other folks from GBS on. Did these comments, trigger anything? Any other questions or comments from the GBS team? All right, great.
No, I think Nate did a wonderful job summarizing all of the issues that practices are faced with today and what the consumerism exists and how to, strategize to reduce opportunities to lose patients and to do things to gain patients. So kudos to you, Nate. That was a wonderful presentation.
Thank you, Mary. Much appreciated.
Okay. I think that unless there's any other questions, that concludes the webinar. Lindsay,
so
any follow-up?
I will. Yeah, I will lead us on out. So, again, thank everyone for attending today's session. I think it was extremely, extremely valuable. I hope you found some information to be useful, helpful. You know, I think the overall theme here is we think of consumerism as, you know, not necessarily in the healthcare industry, but it's here, it's present, and we just need to take a little bit more of a proactive approach about it. So thanks, Nate, for kind of bringing that to the forefront. Just want to let you know, remind you, there is a short survey after the conclusion, after we end the session, for follow-up feedback. Let us know how we did, help us continue to improve, and we also want to know what you want to hear from us. What information are you seeking? How can we be more helpful? How can we, you know, continue to advise you on your journeys? We also will be sending a link to the recorded session. It's also out there on the registration site. So head on out there, see what's coming up next. Take a look back on some of our previously recorded sessions. We also have our next educational session coming up Wednesday, February 10th. Details and an invite should be coming out shortly, but it ties very well into today's topic of consumerism. We're going to be bringing on Carrie Davis. She's the Vice President of Patient Experience at the Hanger Clinic. So everything that Nate kind of reviewed today, we're going to show you some plans in action from someone who that is her sole responsibility for a large clinic. So that being said, thanks again for joining us today. We look forward to seeing and hearing from you on one of our next healthcare education series, Navigating Healthcare Trends and Technology. And we hope you have a great rest of your day. Thanks so much.
Thanks all. Bye-bye.
Thank you.
Thank you. Thanks.